for 4 full weeks. There's no question that we need to keep staying at home. And I want to thank you for the lives you've saved and the lives that you've connected during this crisis with each other. There's no question that this has been a rough ride for everybody, and this was a tough week. We buried more dead this week than we have in any other week during this crisis, and we diagnosed nearly 3,000 more Angelenos just this week alone. But in the midst of tears and facing the tragedy that we have, you have stepped up. You have been incredible first responders. You've shown the heart of the city, and you've shown the guts of Los Angeles. You've shown LA love, and for that, I'm so grateful. There's a lot of news out there that people are starting to fray, and I know that it's been tough on a lot of people. But I want to be clear that while those stories can be found, that's not what we're seeing. 99.9% of Angelenos are doing the right thing. Even across this nation, I believe people want to save lives, that this isn't about politics or partisanship. This is about people, and this is about perseverance. Keep showing your courage. You know, I said at the beginning of this, I wouldn't wait one day longer than necessary to take the actions, the sometimes scary actions to save lives. But I also want to reassure you as well that we won't open things up one day earlier than we need to, but we won't wait one day longer than we need to either. We will continue to be guided by health professionals, by science, by doctors, not playing any games with your life or your lives, but we will do what is right for the life of Los Angeles, now and in the future. So let's turn to today's data. Today's data snapshot is going to offer comparison where we were a week ago as well. And after that, we'll move, as I usually do, into some announcements and updates. Over the past 24 hours, we've lost 4,591 Americans. To put that in perspective, that's more in a single day than we lost in the entire Iraq War. We're experiencing more deaths than 9/11 every day in America right now. In Los Angeles County, we had 567 new confirmed positive COVID-19 cases today, bringing our total to 11,391. This is a 5% increase since yesterday. 1 week ago today, there were 475 new cases on Friday, and a total of 8,430 cases. In the city of Los Angeles, those numbers are 241 new cases, bringing the total to over 5,000 for the first time, 5,093, also a 5% increase. And a week ago, there were just 200 new cases and a total of 3,787 cases. And today we learned of 40 new deaths countywide, while lower than yesterday, an unthinkable number just a week or two ago. It brings the total of our fallen angels to 495 people, which is a 9% increase since yesterday. We'll continue with the numbers, but I want you to say one thing we can't quantify as a loss. It's incalculable. And we know that for everybody out there suffering, that this is not about numbers. This is about the lives of a loved one, and our hearts ache alongside you. And I want to thank again this city and all of Los Angeles for your response to this crisis and the way that it has saved lives. Today, our deaths are doubling every 7 to 8 days, and we're making progress. We really are. That said, the last 4 days have seen the highest number of deaths reported since the beginning of this pandemic, so we've still got a way to go. The data point I haven't previously discussed is our mortality rate. That's the number of people who die from the positive cases that are diagnosed. Today, that figure stands at 4.3% in Los Angeles County. Now, that can change because if we learn that more people were positive, even more than took tests, that number may go down. But at 4.3%, I want to compare that to our seasonal flu mortality rate of just 0.1%. Today, it stands 43 times higher, more deadly than our seasonal flu. And as we come to learn more about COVID, as testing helps us get a more complete picture, we expect that that number may shift a little bit. But if you're listening to scientists, you know how dangerous this still is. and why that number is so important for determining our decisions personally and as a city collectively. Our strategy continues to be guided by physical distancing, aggressive testing, and precautionary measures to stop the spread. And you're quarantining and isolating when you know that you have symptoms or, of course, are positive. So as we head into the weekend, and I know it's a nice weekend it looks like outside, please keep this figure in mind because COVID-19 doesn't care how nice the weather is. It poses a risk to every one of us, and it kills. Making sure our hospitals remain below their capacity is part of how we are saving lives too. As we see in places from northern Italy to our tragic pictures in New York City, when there aren't enough resources, enough beds, enough medical personnel, enough personal protective equipment, people can die. But there's good news here still. In Los Angeles County, our general emergency hospitals have 1,551 beds available, including 1,309 acute care beds and 242 ICU beds. And we have an inventory that we have grown and now have available of 1,119 available ventilators. And we need folks who are infected, even if you are asymptomatic. If you are feeling a little bad, but you're like, I got this, we need you to get tested. We need you to get tested not only because it's important for you to know whether that cough you have or that fever you have, even if mild, is COVID-19 versus something else, but we need to know because if you don't know, you might not be isolated from people you love or when you go out because you think you're okay. And that kills people. That kills people you love, that kills your neighbors, that kills your housemates, that kills your family. So please do get tested, even if you have mild symptoms. Last week, a week ago, we had 19 testing locations across the city and the county. Now there are 30. And I want to thank everybody in the city who's been working on this, and especially our county partners who have just turned up the volume and gone to so many more cities and neighborhoods to make sure everybody has a testing location near them to either drive through or walk up to. Across our city and county sites last Friday, we had the capacity to test 6,000 people, and we had tested cumulatively about 37,000 at those sites. Today, we have the capacity to test nearly double that in just 1 week, 12,000 people a day. And by the end of today, we will have tested a total of 67,000 people, nearly doubling what we had just a week ago. There's about 145,000 tests a day being done in America. And with a capacity of close to 12,000 in a county that just has 3% of the population, that is something to be very proud of. And I want to thank every volunteer and firefighter, everybody working to procure the tests, every lab technician who's turning those around, and everybody who's going to get a test for making sure that Los Angeles can continue to grow that capacity. Because we're working not just to save lives, but also livelihoods. And when you get a test, that helps us all. So one more time, go to coronavirus.lacity.org/testing. Anybody with any symptoms, any age, anywhere in the county can get a free test. We know how hard this has been and how many people are hurting when it comes to our livelihoods. In fact, USC Dornsife Center for Economic and Social Research showed that fewer than half of Los Angeles County residents, about 45%, still have jobs. At the beginning of March, that was 61%. So you see how dramatically this has hit Los Angeles. And people need to pay their bills, they need to make their rent, and I want you to know that there are resources available that not enough Angelenos are signing up for. If your employer has cut hours or shut down operations in this crisis, you should apply for unemployment benefits from the state immediately. And we know the federal rules have changed too, so folks that are independent contractors can now apply for unemployment as well. Having no job doesn't need to mean having no income. So visit the state's Employment Development Department at edd.ca.gov. That's edd.ca.gov. And if you need help navigating the application, if you've never filled it out before, call into one of our city's WorkSource centers or call 311 and we'll connect you there to reach your nearest location. And remember, for those of you who still want to work in a critical industry that's hiring today, whether that's in a grocery store or making deliveries or in a hospital, go to that portal that we set up at the very beginning of this, because there are still jobs available, at lajobsportal.org. That's lajobsportal.org. Working families have been hit so hard in this emergency, and it's also underscored all the inequalities that we have in our society. The work that still needs to be done for racial and economic justice, for those of the community that have underlying health conditions, how hard hit it has been, and of course we know among the most vulnerable population are Angelenos who are experiencing homelessness. Our homeless neighbors know that this was a crisis long before COVID-19 hit. We're already confronting this crisis with record investment, building more shelter beds than any city in the country, over 2,000 of them in an 18-month period. But tonight, I'm enacting some orders to help accelerate the work that we are doing, to extend our affordable housing, to make sure that fewer people stay or become homeless. So tonight, all housing department deadlines that are related to financing affordable and supportive housing for people who need affordable housing or people experiencing homelessness will be extended. That will ensure that affordable housing development can continue without any penalties caused by missed deadlines, and that funding won't disappear because of this crisis. We need that housing. We need every single apartment and every single bed that we can build. And with this virus touching every part of our community, we're doing whatever we can to keep those without a home safe. We've described many of those in briefings before, the hundreds of sanitation stations to wash hands and have soap on the street, the porta potties, the testing that we're doing. And I think that we continue to need more screening, testing, and treatment to help Angelenos who are experiencing homelessness. So starting Monday, I'm proud to announce our city will surge a deployment of street medical teams to help fight COVID-19 among Angelenos who are experiencing homelessness. We'll send out field teams to provide rapid results field tests for people showing symptoms, health and welfare screenings in high-density encampments, which have already started and are in, I think, north of 1,000 visits already, and advice and guidance on effective physical distancing on the streets. We'll offer transportation to new shelters and to hotel rooms to bring unhoused folks inside, and we'll send extra resources, additional county nursing staff, and homeless outreach workers to Skid Row. And our fire department will set up a high-capacity pop-up testing clinic in that neighborhood to deliver fast results. It features physically distanced waiting rooms and provides direct referral and transport to isolation and quarantine beds. All of this means that if we encounter somebody who's living on the street or in their car, somebody who's in a shelter who's sick, they'll be able to test them right away and see if their symptoms are related to COVID-19. And if needed, they'll be able to call in EMS transport to immediately bring unhoused folks to safety. We can do this thanks to our skilled workers across the city and the county, who I want to thank. Our skillful firefighters and police officers, the brave work of our homeless service providers, outreach staff, nurses, and medical professionals, our partners at the Los Angeles Homeless Services Authority and the Department of Health Services, and our leaders at the Unified Homelessness Response Center, which is run all the time, even before this crisis, out of our Emergency Operations Center, who are coordinating this bold strategy. And our work to serve Angelenos who are experiencing homelessness doesn't end there. We're already ramping up beds and services at our Rec and Parks facilities, now more than 850 beds, and 4 more due to open soon. They're at 95% capacity. And tonight, we're launching our first trailer program, utilizing trailers that were given to us by the state, one of the first cities to get these up and running. They will be used to house homeless Angelenos who are in the highest risk Tier 1 category. That's asymptomatic individuals, so they're not sick yet, who are over 65 years of age, have chronic medical conditions, or both. The first 10 are going to open on the campus of Woodland Hills Rec Center, and our goal is to provide more than 300 trailers citywide in the coming weeks. As you can see, we're deploying every resource to help people who are most vulnerable and susceptible in this crisis. So alongside those trailers and those shelter beds, we're renting hotels and motels to house those in need of shelter. So let me update you on that as well. The state and the county and city have currently secured 24 hotels and motels with 2,400 rooms countywide for the Tier 1 Angelenos who are at greatest risk of dying from this virus. but who still don't have any symptoms, to keep them safe, the older adults and people who are already sick. And we're currently negotiating with more than 24 additional hotels. In fact, some of those I think are being signed even as I speak, to add thousands of additional rooms across the county in the weeks ahead. This has been a monumental effort, and I want to thank everybody who stepped forward for the city's and county's Project Room Key effort and the funding help that we got from the state, as well as FEMA, who is reimbursing us for a good portion of those rooms, and my ambassador to the industry, John Vane. People like the hotel owner who wrote to my office this week and said that Project Room Key enables us not only to serve the most at-risk Angelenos, but also to reopen our doors and our rooms and to re-employ our hard-working team and staff back into service. This is win-win-win. It's win for our health, it's win for people experiencing homelessness, and it's a win for employees that were laid off or who had no hours. And she's right. So tonight, let me speak to every hotel and motel owner and operator in Los Angeles County. We need you. Please contact us and become a part of this movement. Get your employees paid. Help us solve this problem of COVID-19 and find a permanent solution to homelessness in Los Angeles County. If you want to be a part of this, please go to coronavirus.lacity.org/rooms. I've spoken to you also about our progress in building a medical relief center in the South Hall of the Los Angeles Convention Center, which usually is full of visitors and conventions, but due to COVID-19 has zero business going on now. And our medical relief center, I can now announce, is ready to receive patients as needed. We built this center to ensure our healthcare system can handle a potential surge in COVID-19 cases. It will serve low acuity patients and free up beds in our region's hospitals. It's there if we have a surge in any of our homeless encampments or Skid Row. And we're working with local medical staffing agencies to bring on nurses, certified nursing assistants, and other medical staff. So far, because you've done a great job flattening the curve, our hospitals have been able to manage the patient volume. But as I've said, our numbers continue to go up, even if they go up more slowly. And people are going into hospitals more quickly than they are coming out. So if we do see a spike in COVID-19 cases, this is a great insurance policy. The Medical Relief Center is ready to absorb patients from hospitals, and we've begun with an initial 175 beds for patients who are COVID negative. And if the need arises, we're ready to both expand the number of available beds and shift course to absorb patients who are COVID positive in other areas of the convention center. Putting this center together is a testament to that collaboration and that spirit of LA Love that I mentioned. Our state partners, Cal OES and Cal Fire, who helped us secure a federal medical station and who are providing very important services. The California National Guard, who helped deliver and set up the station. LAFD, who led the build out and the logistics. The Smith Group architecture firm, who provided the renderings of the space pro bono. And the county, which offered crucial guidance along the way. And I want to thank Andrew Lika, who is the former CEO of Good Samaritan Hospital, who we've hired as chief administrator for the Medical Relief Center, and Dr. Lydia Lamb of LA County and USC Hospital, who we brought on as chief medical officer of this facility. Let me finally recognize also LAPD Commander Phil Fontanetta, who came out of retirement to oversee this project. LAFD Chief Andrew Warden and Captains Chad Richardson and Chris Wynn, who coordinated and managed the logistics of this exceptional undertaking. And I'd also like to acknowledge one additional person on my staff, Jason Crockett. You're doing an amazing job, Jason, and thank you. While we pray for these beds to go unused, it gives us all greater assurance that we are prepared to care for Angelenos no matter what happens in the weeks ahead. Being prepared also means being ready to deliver assistance to all of Los Angeles. That's what our philanthropic efforts have been about throughout Los Angeles. You heard last night about CORE. Each night you hear about what we're doing at the Mayor's Fund. And on Tuesday, as I mentioned, we started accepting applications for Angeleno cards, no-fee debit cards providing direct financial assistance without prejudice to the hardest hit families in our city. And we're still tallying the final figures, but after applications closed for this round last night, as I said, the more money we raise, the more we can give out. It appears that in just 3 days, more than 454,176 applications were submitted. And I want to be clear, that's more than there are going to be cards for now. But with your help, we can continue adding more. And this week, we will start sitting down with those families and those applicants to make sure we can get those cards out as soon as possible to relieve the stress, to relieve that pressure and to relieve some of the bills that people have. So we will contact applicants moving on through the process to let them know the next steps, and we'll also send text messages and emails to those who aren't receiving cards at this time. It's going to be done randomly, but you'll still stay in the mix, and as we raise more dollars, we may be able to get in contact and give you more. But also, please be aware of scams. This made such huge national news that we had people from all over the country trying to get these cards as well, and no official will ever call you and ask for your information like a social security number or a bank account. If you get a call like that, just hang up. We have more people in need than we have resources right now to help, so please do give. mayorsfundla.org/Angelino. And thank you to so many people who have heard about this, stepped up, and put in more money, even doubling down on earlier donations. We're all in this together, and we're going to get through it together. Finally, let me just say in conclusion, I know how sad this week has been. Many of us have spoken with families of the fallen, with people who themselves were unable to hold their loved ones when they died as a result of COVID-19. It left more families that are grieving a parent or a grandparent, a friend, and we're here to grieve with you. One of the cruel things about this is that we can't be together at some of the saddest moments in our life. We're hurting, we're worried, but I want you to know we are not powerless. We have the power to help one another. We have the power to change the destiny of this city. We have the power to change the direction, not just now of getting through this crisis, but what sort of city we want to build coming out of this. This Sunday, by charter, I'll be giving my annual State of the City address, and I'll be going a little deeper into what this has meant and what we might be able to do in the days ahead. But I want you to draw on the power that you have, to not feel powerless or lonely at home, but to feel powerful as part of this city of angels. So stay safe and stay healthy, and please stay at home. Thank you, and all strength and love to each and every one of you. With that, I'm happy to answer questions.
And our first question comes from the line of Steve Gregory with KFI News. Please go ahead.
Hey, Steve.
Hey, good evening, Eric. Thank you for taking the call. I just had a quick question about your opening statements about, because what we're seeing out in the field is a little different than what you just described about people not staying home. We're seeing aerial traffic now from traffic copters and stuff like that, where there's much more traffic on the freeways and the roads than there were just 2 weeks, 3 weeks ago. And it's really starting to become pretty much an everyday occurrence. More and more people are getting more bold. And I'm just wondering, at what point do you sort of adjust and pivot to make sure that this is either going to be taken care of or you're going to tamp it down a bit?
Well, there's two things that we look at. One is the data of the cell phones, not individual cell phones. We don't have that, and nor do I want it. But to the anonymized data of where people are moving. And that stayed pretty constant. There's no question that we see that, and I know you might be speaking about parts of outside even the city. We've noticed one trend, for instance, along PCH, that is one of the few areas where you see beginning and end of the day still yellow, where everything else is green. Occasionally you see red on a freeway. That's usually because of an accident. We see at rush hour still some places that are pretty crowded, but not anywhere close to where it was before. And so we go by the data, but there's no question we won't hesitate if necessary. We saw this week, for instance, at the skate park at Venice Beach, and people were there, so we had to put sand into the skate park to make that unusable for now. When we come out of this, we'll clean that sand out. We haven't hesitated where there's businesses that continue to flaunt the law. Today we had the first shut-off of the power of a smoke shop in Reseda that 5 visits later still refused to shut down. So we do have a good arsenal of tools to use. We're continuing to do enforcement. We appreciate people telling us these things. But I would underscore what you said. For anybody who said, oh, it's been now 4 weeks, I'm getting out of the house more, please don't. That's not just bad for your health. It's bad for everyone's health, and it can kill someone. It might feel like you haven't been out much, but you could be asymptomatic and a carrier from a trip that you took to a market where somebody else asymptomatic or who was out there and shouldn't have been had it. This is how things explode quickly. And as we said, one projection I will keep sharing with you, if we lifted the veil of everything tomorrow and said everybody go back to normal, 95% of us, it is estimated, would have COVID 19 exposure by August 1st. I don't have to tell you what 9.5 million people in this county going through in the next 4 or 5 months COVID-19 would mean to our deaths, our death rate, our hospital capacity, et cetera. So also, though, in a hopeful way, please stay home, because we are having those conversations and pushing our state and federal governments and working together with the county on where can we write the rules of the road, get the blood testing, figure out the ways that we can move forward. And I do want to say two things that I mentioned last night, because I want to use different language, because I think people can misinterpret it. When we need more testing or talk about things like immunity passports, those are things in other countries that companies in other places said in order to work here we need to have. We're going to always do this with the values of our society, making sure we're not a police state, we're not going to become an authoritarian state. This relies on people's good behavior, and where necessary, some enforcement. But we're not going to start taking people's data, we're not going to surveil people. Sometimes that word surveillance is used. All that means is a medical term. We need to know how many cases are out there, and that's done through blood tests. So it's more situational awareness or case tracking. And those things, I think, are going to dictate that we can, in the coming weeks, I spoke with Dr. Ferrer, she's talked about this a little bit publicly, you know, if we keep this up, sometime in May, we can see some things potentially be relaxed with new rules, with very careful safeguards about maybe which shops open or some of the things that we can get back to doing. But that has to be designed very carefully with our public health professionals, and even the best case scenarios, that's still a couple weeks at a minimum off, if not more. So we need to make sure that we stick with this, because I guarantee you, for everybody who's going out there and thinking, hey, I can drive or walk or put myself a little bit in harm's way, it takes about a week or two before you see those numbers creep up. And if I'm here a week from now or 2 weeks from now or 3 weeks from now saying, you know what, the curve isn't flattening anymore, you're going to see this extend even longer, and none of us want that. So please stay at home. Thank you. Next question.
Next, we turn to the line of Robert Kovacic with NBC. Please go ahead.
Hey, Robert.
Mayor Garcetti, how are you, sir?
Hanging in there. Strong.
So, to quickly follow up on what Steve Gregory said, but I do have another question.
Sure.
San Diego has started citing people, the people that are violating the stay-at-home orders. We check with the LAPD every day to see if it's something that they would do, or the Sheriff's Department. So far, not yet, but I'm wondering if that could possibly change. The bigger question, though, is if you can look to the dates that you have given us, that we are going to see peak hospitalizations today, a peak in deaths on Sunday. With that said, and if we continue to follow the numbers as you are seeing them right now and the projections, could we possibly begin the phase 1 of the government guideline right in the middle of May when the order is supposed to be lifted?
I think we could, Robert, but that depends on all of us. So I know whenever I say this, then the headline is usually what comes out and people click on it. Like when I was asked my opinion about whether we'd be in stadiums in a private meeting, and suddenly it was on the front page of CNN that we weren't going to have any sports in any way. So I want to be clear, this is a snapshot of today, but absolutely, I think that is possible. And I do want to give people hope that the work that we are doing actually will have an end to it. But I want to be clear, too, that's not a flipping on of a light switch. It's not everybody coming out. There are people who are still very vulnerable. There are new rules that we have to write because we're going to have to interact in public spaces and workplaces and potentially schools in a new and different way. But that, I think, is something that is in the realm. We're seeing in Europe, who was a couple weeks ahead of us in terms of infections and cases, some places that have been as successful as us with our physical distancing measures and other, early measures that I'm very proud that we took, beginning to look at that. But the headlines can be deceiving. Somebody said, Germany's opening up. Are we soon? Germany, in certain places, in very limited ways, is opening up. Denmark opened up some schools, but the kids are spaced apart and it's just starting and they're experimenting to see what happens. So I think that could be realistic, no question. In terms of citations, that is something we can use. We've certainly cited businesses and we've referred them even more to criminal proceedings, more than a citation, and with a stronger a little bit of muscle behind that than just giving somebody a ticket. It's not my preference, though. It's not what I want to turn Los Angeles into. And as long as we continue to make steady progress, we're going to tell people you need to stay home. We're willing to do that. If necessary, but we'll do that in conjunction, I think, with the county, with public health, and seeing what's most effective. And as long as I still see the data that this is an exception, not the rule, we'll continue to use public education. We'll continue to let people know that there are consequences, and we won't, unless things get bad, I think, go towards that level. Thank you. Next question.
Next, we turn to the line of Elizabeth Chu. Please go ahead. Your line is open.
Hi, Liz.
Hi, Mayor. Thanks for answering questions every day like this.
Of course.
I wanted to ask a few questions. My first one is you're doing your State of the City address that will take stock of the last year and to chart your vision for the upcoming year, the priorities. I was wondering how you plan on tackling that in this context. And I have two other questions. One is about whether there's a goal for how many tests to be made available per day that you think will allow for widespread testing to be available even to people without symptoms. And also, how much have you raised as part of the Angelina campaign? And how many of the 450,000 might be getting the first wave of
Sure.
I guess, checks or debit cards?
I'll work my way backwards, Liz. We don't know because it'll depend on the size of the families. It's 700, 1,100, or 1,500, depending. So part of that will depend. We've raised, I think it was 10 million last time I checked, but it might be even higher. Hopefully we'll get even higher. And we'll continue to try to add more into that. That was the goal, and I think we hit that, but we're hoping to get some of those checks in. That was pledged, and I believe it's in the bank now. And my goal is to, every moment we can, if we can double that, we can help twice as many people. If we can triple it, we can help 3 times as many people. And I would really encourage those of means who can. This is a moment to dig deep. If you have savings or you've been lucky with your life and have millions of dollars, this is a moment to share that. And I think for so many of us, my wife and I, we have done that. We have. Everybody's given, whether it's $5 if they can, or $1,000 if they can, or $20,000, or some people who can have given millions. And I'm so grateful to them, but that will ride on how much, but we're up to 10 million, I'm confident already. A second, with widespread testing, there isn't a magic number where we can start testing people who are not symptomatic at all. And, because you have, at that point, 10 million people to test. And while our capacity is probably in the top 5 in the country and one of the top cities in the world, quite frankly now, we unfortunately don't have anywhere close to 10 million tests that we could do, testing people with the virology tests frequently, like once a week or even once a month. So that's still a while off. But we may be, in coming weeks, if we continue to build at this pace, be at a place where everybody who's symptomatic can be tested and they're not fulfilling all those tests. We will start to look at asymptomatic people, especially for that situational awareness that I mentioned, knowing how many people actually have it. And I hope that we can offer some of those tests with the blood tests that we're undertaking. Because remember, blood tests are a historical snapshot. Did I ever have COVID-19? Because the blood test will show antibodies generated in response to that. But it doesn't say whether you're contagious or not. At the same time, virology tests show you whether you're contagious right now, whether you have symptoms or not. And if we could give those to the same people, we could see, are some people showing evidence that they had it, but they are not contagious, or vice versa, some people contagious, but the antibodies have not yet been created. So we can look at using that to further the work that we're doing that will help us get to a place where we can open more quickly different parts of the city. And then third, State of the City, I just have to say, stay tuned. I don't want to give the speech now that I have to give on Sunday, but I'll tell you the values behind it, that this is an immensely difficult year, that we will have to make cuts in our basic city services, that we will have to tighten our belts and have shared sacrifice as a city workforce, that some of the most important things that have been laid out in this crisis of our values, but also our priorities, need to continue around public safety and health and housing. And then lastly, I want to challenge our city not just to think about trying to rebuild the city of old, but how do we take this moment and a tragedy and from it find some triumph of a way that we could rebuild a city that doesn't just come back economically, but is more fair for people of color who don't have the same starting line that other people do, for poor folks and immigrants, for people who've experienced violence, for children who are in schools that don't have the same education as other schools. Those sorts of questions is something that I'm going to are something that I'm going to propose this Sunday, and challenge us to not think about just getting through this, but getting through this stronger and better than we were before. Thanks, Liz. Next question, please.
Next, we turn to the line of Ben Areskis with LA Times. Please go ahead.
Hey, Ben.
Hello, Mayor. Hope you're feeling better.
I am.
We have heard, Doug and I have heard from county officials and city officials as well, that how with Project Room Key, there's been some challenge or struggle to lock down rooms in hotels for homeless people downtown near Skid Row.
Yeah.
Have you determined whether you have the legal power, authority to force hotels to be used as housing for homeless people or anyone during this emergency, even if the owners of these hotels don't want that to happen?
Sure.
And if you've chosen not to go that route, why is that?
So we have made some good progress. I hope that some of the things that we were talking about earlier in terms of some of the contracts that are under negotiation right now should be announced in the coming week. So that was a priority, and I think we've made some headway in downtown. I do have the authority, though we have the obligation financially in those places as well. I can take property as part of the emergency powers, but we're liable for that, and that can be a long, drawn-out fight that sometimes is more expensive than good negotiations. And I will not take that off the table. If that's necessary and we're coming up short, I think this week, finally, we saw some really good progress, and there's been heroic work by the county, by the state leading up to this. It is not taking a single thing away from them. I'm really glad that we could add John Vane as the person who's sitting down and talking to more hotels and more motels. And it's not just in LA City, of course, it's throughout the county. But I won't hesitate if we dry up and suddenly come to a point where we aren't getting new rooms or we aren't keeping pace with the number of people who are willing to come in, then absolutely, that would be on the table. Next question, please.
Next, we turn to the line of Claudia Pashuta with KNX Radio News. Please go ahead.
Thank you. Hi.
Hey, Claudia.
Given that you're talking about furloughs and big cuts, I'm wondering, and I'm taking a page here from my colleague Steve Gregory, who asked this on the county side, but I'm wondering if you would consider, taking a voluntary pay cut yourself, if any of the city council members, others in the city who get higher salaries might be doing something like that, even if it's just as a show of solidarity.
Sure.
I know it's not going to solve your budget problems, but, to set an example.
Yeah, I prefer not to always publicly talk about these things, but since you asked me, I did donate the equivalent of my salary for this month to the Angelino Fund to help Angelinos who don't have that. I think that is a show of courage and a show of solidarity, and something I'll continue doing in this crisis. Absolutely. But I don't know about other council members. Next question.
And next we turn to the line of Carla Hall with Los Angeles Times. Please go ahead.
Hi, Mr. Mayor. Let me actually follow up a little bit on something that Ben just asked.
Sure.
With the hotel owners that we're hearing are kind of resistant to signing leases, are you at least maybe calling some of those people and trying to persuade them to sign leases?
Yes.
And then on a related matter, is there any thought of stopping expanding the rec center shelters and just concentrate on putting people in hotels and motels and maybe the trailers that you just mentioned? And I know you haven't had a lot of cases, or many cases, of COVID in the shelters, but once you get one, you end up quarantining the entire shelter and the whole thing gets complicated.
Yeah, that's a good point. We don't always. We had one where we didn't need to, and we always go on public health advice from the county, But no question, I want to make clear there's no one team that if we're working on hotels can't open up shelters, or vice versa. If we're opening up shelters, we can't work on hotels. We need to be doing both at the same time. But there's no question that it's not just in congregate shelters where people can get sick. Hotels, we've seen throughout the country, are places where this can spread too. There's shared HVAC systems, et cetera. So they're not perfect, but I do believe them to be better, as long as they have two things. They have the same sort of services there and the same sort of health. In a congregate setting, it's easier to do things like provide food, have nurses check on temperatures, et cetera, than in hotels and motels where people come and go and not everybody's there and you don't always see. But I do think that hotels and motels are absolutely a great solution, and one that we put ourselves into. It was originally the state said, hey, we'll do this with counties, and we said, can we help as a city? County said, absolutely, we welcome you, and other cities are doing that too. In some cities they've opposed, but we don't have to name those tonight. But most of them have stepped up and together with the county said, we realize this is an emergency And so, yes, I have personally talked to folks. I'm willing to pick up the phone with any hotel or motel owner. But so far, the pace really, I want the story to be not that it's been tough. This has been a really good week in getting hotel rooms. If you told me just a couple weeks ago you get more than 1,000 rooms in a single week, have a couple thousand or a few thousand more ready to sign, that would have been difficult for me to believe. But I really do think that the momentum has started. It's well past the pump being primed. We're getting a lot of interest. We're signing a lot of contracts. We won't always be able to say where they are, to be clear, too, because remember, not just going for folks that are experiencing homelessness, but sometimes a mix of people who are not and or who are experiencing domestic violence. And we had direct contacts. I've talked to one hotel owner, for instance, that helped us make sure that we had a hotel for victims of domestic violence because nobody was moving out of shelters, understandably, and a lot of people needed to move into those to save their families. I hope that helps. Next question. Thank you.
Next, we turn to the line of Kate Nishimura with the Sourcing Journal. Please go ahead.
Hey, Kate.
Good evening, Mayor Garcetti. Thank you so much for taking my question. We are a publication that serves the fashion industry and its retail and supply chain partners. My question for you is for the massive network of LA brands, retailers, and manufacturers that are dealing with store closures and other disruptions to their businesses. I know many are already engaged through the LA Protects program led by your office to manufacture much needed PPE, but what other measures can members of this industry take to stay engaged with the community and maintain the health of their businesses through this crisis?
Absolutely. Look, we're going to be looking together, and it was great to see the governor's announcement of his economic task force and some great Angelinos that are serving on that. I've been talking with the county in depth and Dr. Ferrer, Chairwoman Barger, about what our efforts need to be here at the local level, because I think that LA can lead in a number of our industries. We can write the rules potentially for the country and the world on entertainment and music. How do we get back to filming? How would we have concerts even if there's no audiences? Sports, things like that. And fashion is one of those areas that we've talked a lot about. The apparel industry, my grandfather was a tailor. That's part of the reason I'm here today, was because the opportunities this city afforded him in the apparel industry. And we have to make sure we don't lose those jobs and lose them permanently. So LA Protects was the first part. As you mentioned, this is the facial coverings being made by LA sewers and LA sewing machines. Folks that right here are helping meet a need and hopefully being able to get those folks back to work. But I hope that as we look at the new places that we will open up and the rules that we write, that this can be one of the first industries that can get back to work, because it is possible to space people safely. It is possible to protect them. And that will also help us, as Dr. Ferrer said, at a certain point, people need to get some clothes for their kids. We have to look at our retail establishments. And while it'll be very different, we might have temperature checks. We might have people phased to come into stores. Those are the sorts of things that I think we can begin to see the rays of light ahead. In terms of other things, I would say just other PPE is helpful. I know the materials are difficult to obtain for the medical grade, but there are folks out there who need protection, not just facial coverings, but in places, folks who drive taxis and rideshare, people who clean hospitals and things like that. So that's another area. All of that can be done if you're interested in a business through LA Protects, and we can connect you with much more than just making face masks, and know that it really is a priority for us to save this industry, to get it back on its feet quickly, and the number of low wage workers that are there who are really hurting right now. The best way we can help them is to help them get back to work. So thanks so much, Kate. Next question, please.
And our final English question comes from the line of Doug Smith with the Los Angeles Times.
Hey, Doug.
Go ahead.
Hello, Mr. Garcetti. I wanted to ask you, you have alluded to the fact that there have been cases at shelters, positive tests at shelters. Are you considering, or have you started doing any preventative surveillance testing at shelters?
With testing, we've done some, and we are working with all of our homeless service providers, especially the medical providers, to do proactive testing on the streets, and that includes people who we could test before they go into shelters. There are medical checks before anybody goes in. When there are cases that happen, we have the public health department of the county there, and we follow their advice. And it's worked the way it's supposed to be. From the beginning, when I talked with Dr. Ferrer and her guidance that it was much better to have people off the streets and in congregate shelter as long as they were spaced apart. as long as they were screened before coming in, than having them on the street. But she also cautioned there will be people who do get COVID-19, have positivity, but with folks there having facial coverings, folks spaced properly, it's much better than on the street. So far, it's worked the way it's supposed to. But in terms of going in there and testing everybody, we've done that in cases where we've had somebody test positive, but not proactively yet. We didn't have enough testing for that. But as I mentioned, we're starting that targeted testing towards folks that are on the streets and who may be living in shelter, especially here in Skid Row with the pop-up that we'll do, and that will allow us to have those tests. We've also talked to some shelters that are privately run, and we've been able to provide them with testing to proactively done that. And by privately, I just mean by nonprofit groups that aren't part of the rec and park shelters. Thanks, Doug. Next question. I think there's one in Spanish, is that right?
And our next questions come from Spanish. First from Abel Alamillo with Telemundo 52. Please go ahead.
Okay. Good evening. Buenas tardes.
Hi, Mayor. In regards to the use of motels and hotels, would symptomatic homeless patients be housed at these locations? And what would you tell those residents who oppose having motels and hotels house the homeless in their communities?
So I'll answer this in English. I think people have, for the most part, really embraced this, and I want to thank folks because they know that there's been a public health crisis called homelessness long before COVID-19. And the best way we can start to serve that is getting more and more people indoors. There's never 100% agreement, and those who oppose and sometimes have louder voices. But besides a case or two that I've talked to supervisors about, cities have embraced this. And sometimes some of the motels that we're talking about have themselves been problems. They've been places of prostitution or drug use. They've never had security on site the way that these do, never had services on site the way that these do. So it actually is an upgrade to look at using them as a shelter as opposed to some of the uses in the past. So I would say we can save a life and we can transform a life. And in terms of the rooms themselves, there's two different types of them. There's tier 1, which is for folks who have not yet had any symptoms, and we're keeping them safe because they're very vulnerable. And then there's tier 2 for people who do have symptoms and who have tested positive for COVID-19. Those are for folks without homes as well as with homes who might not have any place else to go for quarantine. So en español yo quiero decir también que es importante en todas las ciudades del condado de Los Ángeles aceptar estas habitaciones en hoteles y moteles por las personas que están experiendo indigencia. Los indigentes de Los Ángeles merecen un lugar seguro donde nosotros podemos obtener seguridad, comida y cuidado médico. Y es mejor en nuestras comunidades a tener nuestros hermanos y hermanas de las calles en hoteles y moteles de las calles, en los campamentos donde COVID-19 es una amenaza muy grande. Espero que todas las comunidades no solamente puedan aceptar pero con el condado y el estado nosotros podemos encontrar más dueños de estos hoteles y moteles que pueden dar estas habitaciones a la ciudad, el condado, porque también sus empleados pueden trabajar. Y es bueno por la salud de nuestra economía y contra la indigencia. Gracias. Thank you. One more Spanish question, I understand?
And our final question comes from the line of Victor Cordero with Estrella TV 62. Please go ahead.
Hola, Victor. Hello.
Alcalde, ¿qué tal? Muy buenas tardes.
Buenas tardes.
Thank you very much for doing this and answering questions. I'm going to ask in English and then I'll try to do it in Spanish really quick.
Okay.
I remember the first time that you did the virtual press conference, like if it was yesterday, and sometimes again, I think it was like ages ago, when you said at the end, our lives will change forever. That still bounces in my head, like I even get the chills. If you can talk to us really quick, after a few weeks of being in quarantine, how has this changed our lives? And how is this going to be our new normal? When kids go back to school, when we can go back to a restaurant, or when we can go back to a concert or a sports event? I'm going to do it in Spanish really quick.
Sí,
Alcalde,
claro.
Cuando dio su primera conferencia de prensa virtual, yo me sorprendí mucho, como si lo escuché ayer o como si han pasado décadas, cuando usted dijo que, para terminar, que a partir de ese día la vida de nosotros los angelinos iba a cambiar para siempre. Si nos puede ayudar a decirnos cómo ha cambiado esa vida y cómo cree que va a cambiar una vez que regresemos a la nueva forma habitual de vivir, en donde nuestros niños vayan a la escuela o podamos ir a un restaurante a cenar o a ver un concierto o a un evento deportivo.
So in English first, our lives have changed fundamentally, but I hope not permanently. And I know in my bones it's not permanent, that this will not be the way of the future forever, and that our diligent and hard work to respect the order, safer at home, has made sure that lives have been saved and that days have been shortened when we will return to being outdoors. It won't happen in one day and it won't happen all at once, but it will happen. And I think what's changed is a couple things too. For our children, this will be the fundamental moment of their childhoods. This will be like their 9/11. This will be like their Challenger disaster, these moments in time that are seared into us, our earthquake here. This will be like all of those put together and extended. Days feel like years today, and I hope that one day years will seem like days. And we'll remember these dark days, but we'll be proud of them. And I hope that the last thing that changes is not just the economy, but that if we come back together, that we will see a changed attitude towards one another. Look, I'll be honest with you, I think a lot of people feel like we're at that moment where this might start to fray. I'm confident that we all can lead away from that this doesn't have to go back to us hating each other because of what party we're a part of, or what color we are, or what religion we have, that we practice. We can't go back and let this be a tribal moment or a desperate moment. We have to remember the best moments of this crisis, which 99% of the time has been when we've helped a neighbor, shopped for a senior, given a donation to a food bank, made sure that somebody who is our son or daughter isn't scared, and that we apply that to making sure that when this crisis is over, that we make sure that every kid has the same start, that we don't drown people in college debt, that we don't have more homeless on the streets of this city than anywhere else, that our immigrants are not forgotten. I hope that's what will change in a positive way from this. So, simplemente esta crisis ha cambiado nuestras vidas. No es normal, pero el nuevo normal no debe ser las condiciones de hoy, pero pueden ser nuestros sueños de mañana. Espero que durante esta crisis, este trauma para nuestros jóvenes, por ejemplo, por nuestros hijos, este es como 9/11 o un terremoto, es los días más importantes de su juventud. Pero después de este desastre, espero que nosotros podamos recordar los actos de generosidad, de amor, que nosotros tendremos una ciudad donde inmigrantes están respetados, la gente en las calles no existen, y tenemos la oportunidad a cambiar nuestras actitudes en este país y tal vez en esta ciudad también. Yo tengo mucho orgullo ser el alcalde de esta ciudad de Los Ángeles, pero necesitamos recordar nuestro nombre y acta como los ángeles que somos. Y si este es el resultado de este tiempo, es una victoria.